Fredericksburg, Texas. Hello, world. JD Rose with you here. Welcome to Informing Fredericksburg. To inform means to form what's inside. Nothing has more power to form our thinking or our being than the power of words. That begs the question, what words, which words, whose words? Informing Fredericksburg. And our very first guest on the show is Dr. James Partin from Hill Country Memorial Hospital, the Chief Medical Officer since, 2011. And you graduated from UTSA Long Medical School. That's a perfect name for medical school because it's long. It's a long time that you guys go to school, but you graduated there in 1976. But Dr. Partin, tell us a little bit more about yourselves before we get into the questions.
Well, I stayed in San Antonio and did my residency in internal medicine, and then initially started my practice in Lubbock, but moved here quick as I could.
Right.
1996, and practiced internal medicine both in hospital and out of hospital. And then 2011 became the chief medical officer. Went back to school at that time also.
See, more school.
Yeah. I was not trained well enough to do an administrative job, so I did a master's program in Harvard and finished that in 2013. And have been working with the hospital ever since.
Well, welcome to the show, and we appreciate, I know your schedule's pretty hectic, not just pretty hectic, but extremely hectic right now. So thank you for taking time to be with us today. And we're going to fire some questions at you here in just a little bit, but first we're going to take a break. We'll be right back. Texas Hill Country Bank understands these are challenging times, and they want to assure you that your favorite bankers are still there to help via phone or email, and their bank remains strong and focused on their customers. With mortgage rates the lowest they've ever been, now may be the perfect time for you to refinance your home. Or maybe you're looking for a low-interest loan for your business. They'd love to talk to you. And if you haven't already taken advantage of their mobile and online banking options, give them a call or visit them online, TexasHillCountryBank.com, where good people make good bankers. Member FDIC.
Bee Creek Communications is celebrating 20 years of connecting the Hill Country, 20 years of scaling towers, climbing roofs, installing networks, wireless broadcasting, timely responses, friendly service, technical support, expanding coverage, increasing speeds, keeping promises, providing our community with always-on high-speed internet. Bee Creek Communications, celebrating 20 years of serving you.
All right, we're back informing Fredericksburg at the Bell House B&B studio. Beautiful set, and we certainly appreciate the Bell House here in Fredericksburg, Texas, USA. JD Rose visiting with Dr. James Partin now, the Chief Medical Officer at Hill Country Memorial Hospital. How many confirmed cases do we have in Fredericksburg right now? Is there any confirmed cases at this time? What are the numbers?
We have no confirmed cases. We have sent off 147 tests to both the state as well as to private laboratories. We have about 58 of those that are back that are all negative. We have some that are still pending. And those that are pending, we should be able to get those back hopefully today, if not through the weekend. And we will continue testing as best we can. The test kits are not as unlimited as you would be led to believe. We had, at last count, around 230 test kits in the hospital, and we're utilizing those whenever it is appropriate. Testing really at this point should be done with people that have symptoms. In the recommendation, if you have very mild symptoms, that may be fever, cough, maybe a little bit of shortness of breath, you should actually stay at home and treat that without being tested, and should quarantine yourself at least until you're asymptomatic and temperature free for 72 hours. Now, those that have more significant symptoms and those that are at risk, and those at risk are anyone over the age of 65.
We certainly want to take care of them first.
Absolutely, and those that have comorbidities, diabetes, heart disease, lung disease, those should be tested. And we have set up a testing process outside the hospital so no one is exposed. It's through a drive-by. The patients do not get out of their car, and they're swabbed and tested in their car, and therefore no one in the hospital or no one otherwise work in the
And that's
hospital.
set up already?
That's been set up now for about 2 weeks.
2 weeks. Where's that?
That's at the hospital currently is
Okay.
near where the old MRI building
Okay.
that we use was. The process of that is you have to have an order from your doctor. Your doctor has to screen you for the symptoms that are appropriate and the signs that are appropriate, and then writes the order. Then the hospital takes it from there. Hospital will contact the patient and tell them what to do, pre-register them, and have them come by and we'll swab them. We're setting up the hours right now of that between 10 and noon and 1 to 3, Monday through Friday, not testing on the weekend at this point.
The hospital's been trying some different labs, is that correct? To try to speed the process up a little bit? How's that
Well, first of
going?
all, with the first lab was a state lab, and they were very restrictive as to who they would test. They would only test people that had all the right questions. Initially, we had a lot to do with travel and then high-risk patients. But also, we started using a private laboratory, LabCorp. In private LabCorp, they were getting so many tests. They're doing it all in North Carolina that they were way backed up, and their turnaround time was about 7 days. We did start using CPL laboratory this week. They're also restrictive to patients that have the proper symptoms, the proper signs, the proper risk factors. Their turnaround time has been less than 1 day.
Wow.
In fact, we sent out tests, I believe it was Tuesday, left the hospital at 6 p.m., and by Wednesday they were calling me the results at 7 a.m.
That's fantastic.
It is fantastic.
That is fantastic. So how many people have been tested in Fredericksburg? Where are we at as far as some of the numbers? And where do you get a lot of your accurate information from outside of what you know here in Fredericksburg? Where do you get all your information from?
We, and of course the public can do the same, get our information from cdc.gov. Various number of things on that website that are very helpful, and also the state. And the state website is dshs.texas.gov/coronavirus. And they have links in that also back to the state. There's an extremely good interactive map now on the DSHS website on the front page. And when you click on that, it gives you a map of Texas. It's what's called a heat map, where the number of cases are represented by circles on the map, county by county, and the larger circle is the more cases. And that map has exploded over the last.
Well, right now, as I understand it, don't we have more cases in the United States than anywhere else in the world right now? Is that true?
We have more cases than China had during their outbreak.
My goodness.
We have more cases than Italy has had, and the numbers are really increasing very, very rapidly. We're still on the very upslope of the curve.
But speaking of the curve, this is a good time to ask this question. What does flatten the curve mean, and you know, what exactly does that mean, to flatten the curve?
So the curve basically is the number of cases, and the curve basically goes up, it peaks, and comes back down. Now, without doing any mitigation maneuvers, that curve is going to far exceed the capability of the healthcare system, and here locally, within a matter of probably 30 days. If we slow down that curve, flatten it, and the way to flatten it is to reduce the spread. And reduce the spread is done by social distancing, meaning no travel that's not necessary, meaning don't congregate in any groups. The state has basically put that group size at 10, probably should be even less. Don't leave your home unless it's necessary, and don't get within 6 feet of anyone when you do leave your home. Don't go to anyone's home if they're ill, and if you are ill, then stay home. And that's the only way we can flatten that curve. And the state has done some maneuvers to help that. There are more that they can do, and there are more than they have to do, particularly as this begins to grow, particularly in the Dallas area, San Antonio, Austin. Austin now has over 115 cases as of last evening. I think San Antonio had 84. Dallas area is up in the 300 range, and those numbers go up fairly rapidly.
And I know you can't look into a crystal ball and predict what's going to happen in Fredericksburg, but do you, in any way, you anticipate our numbers to go up and eventually some cases come out?
I would be surprised or shocked if we don't have a case by the end of this week.
Okay. That's why you're wanting people to move and get things done and,
Right,
and getting with the city of Fredericksburg, which we'll talk about in a little bit.
Right.
So what has the hospital done to prepare? I know you...
So we've been actually working on this for a long time. We started actually listening to daily calls from DSHS probably almost 2 months ago. First thing we did was started looking at preparing with our supplies. PPE, which is personal protective equipment, meaning gown, N95 mask, goggles, gloves. You have to have that to protect yourself when the case is active. And those supplies have been, if limited. So we started procuring those every place we could. We've also now started looking into and have some reusable gowns that are a impervious cloth material that can be washed and reused. We're looking at ways of actually reusing our mask. We have two what's called TruDs, which are ultraviolet sterilizing equipment that we use to terminally clean our rooms in the hospital when someone is dismissed. We can put those in a room, hang up our mask, and sterilize those masks and reuse those. We also started looking at our pharmacy supplies, what drugs may need. You may have heard that we are now using hydrochloroquine as well as Zithromax to treat patients. It's anecdotally effective. There's not been any really good studies done yet that are really true double-blind studies. They're in the mills, but we have enough doses now that treat 130 patients that we stockpiled. We're also looking at IV fluid, equipment for oxygen. We now have also assimilated, I think, 11 respirators. We had only 3. What we've done, we've converted our anesthesia machines that are not being used now because we limited our elective surgery to 0. And those anesthesia machines can be converted into ventilators. So we have that many. We also started looking at our personnel and what we would do if we get a true surge of patients. And right now we have 3 isolation rooms in the hospital. They're what's called negative pressure rooms.
Yeah.
2 in ICU, 1 on 217 and 2 North. But we can convert a wing of the hospital, OB wing, and the reason we would consider doing it there is that is an area that was recently remodeled and has an air handler that only services that area. So none of the air from the OB ward gets actually filtered back into the rest of the hospital. We can hold up to 14 people in that room, or that ward. The problem with this is, and why the hospital really gets overrun very quickly, is the length of stay of these patients. Average length of stay of someone that is on a ventilator right now, non-COVID-19, is about 3 to 4 days. The average length of stay of someone on a ventilator with COVID-19 is anywhere from 11 to 21 days.
So that bed is used that long.
That bed and that ventilator is actually tied up for that length of time. And so the numbers can really get overwhelming very quickly when you start putting them in and keeping them that long. We have meetings every day to look at how prepared we are and to assess. We have actually looked at how we're going to deal with our home health and hospice to support people to remain in their home. And they have been training as far as our PPE as well as ways to deliver care remotely by telemedicine. Our medical group is now doing telemedicine visits, either with their phone or with their iPads.
Modern technology, yeah.
And I think that will be a game changer that will survive all this. I mean, that's something that a lot of people have been wanting for some time. But that will allow people to be seen without having to come into the doctor's office, without exposing other people if they are carrying COVID-19, and still have them cared for.
All right.
The emergency rule of the governor allowed that to expand dramatically. Before, you could only see someone with a telemedicine visit if you already had an established relationship with that doctor. Now you can establish yourself as a new patient over telemedicine based on the emergency ruling of the governor.
Man, we appreciate the information. We certainly do. We're going to take a quick break, come back and cover some more ground. We'll be back right here, Informing Fredericksburg
Creek Street Dental utilizes the latest technologies in dental care. Dr. McBride has been specially trained to offer the Hill Country sedation dentistry. Anxious patients can sleep through oral surgery in a private room with family nearby. Their CBCT machine provides near silent imaging, making possible the most painless and effective treatments. iTero technology allows virtual manipulation and modeling, so no more gagging on impression trays. Call 830-990-1178 for the best in your family's dental health today.
Vogel Tractors, specializing in low-hour, high-quality ag equipment. Area farmers and recreational landowners put their confidence in Van and Jamie, knowing their tractors, loaders, and farm implements will exceed expectations. All equipment is well-serviced and field-tested, and if new is what you need, Vogel Tractors is your Rhino Ag equipment dealer in the Hill Country. Warranties, financing, and delivery is available locally or nationwide. Vogel Tractors, located on Highway 290 between Fredericksburg and Stonewall.
Segner's Jewelers supports the community during this difficult time. We will get through this. They're here to help any way they can. From their family to yours, God bless and keep the faith. From Segner's Jewelers.
Cordially Invited, a special service for special events, anywhere in the Hill Country. Family and friends won't have to miss it after all. From the producers of Billy's.live, cordiallyinvited.live. Find us in all the familiar places.
And we're back informing Fredericksburg. J.D. Rose with Dr. James Partin, the Chief Medical Officer at Hill Country Memorial Hospital. Recently, someone that was employed by the hospital in some form or fashion tested positive. Can you shed some light on that story?
The story is that this was an individual that was a consultant for us, was here 3 days every month, went on a ski trip with a friend, and then came back from the ski trip and worked those 3 days. She left here to go to another consulting job in Hawaii. When she landed, she had calls from her friend that her friend had tested positive. She was having some symptoms, cough, and fever, and when she tested there in Hawaii, she tested positive. So she exposed in a non-clinical area of the hospital about 7 or 8 people that was in her clinical area, or non-clinical area. They were all tested and all went to a 14-day quarantine. They've all completed that 14-day quarantine. No one has gotten ill. That's not true. I have one person had some symptoms. That person was retested, and that retest was also negative.
Good.
So we've had no of our employees that actually tested positive from this exposure, and they're all back to work as of today. And so that, if you look at the website, that's not attributed to Fredericksburg because her residency was actually in Bexar County. And they attribute these cases to your residence of record and not where you tested, not where you had been. And so we feel very comfortable that we still remain safe. And I can tell you we've actually made it more safe. It's somewhat of inconvenience to people, but everyone that comes into the hospital, employees and physicians, all get their temperature checked coming in. The patient and visitors also have a nurse that questions them and goes over things. Are you having symptoms? Have you done any traveling or been with someone with known COVID-19? Are you caring for someone with COVID-19? And if they answer positive to those, we're not going to let you in the hospital. We're going to protect everyone that comes in that hospital. If you feel comfortable, if you're in there, everyone that's in that hospital has been questioned and they have had their temperature checked.
All right. Now, the hospital recently requested an immediate shelter-in-place order. Can you tell us a little bit about that? How is that progressing with the city of Fredericksburg?
Well, so far, they've not actually agreed to that as of yesterday evening. We base that on a model. It's a model that was put out by Penn University, where you can plug in a date, the day of your first case that you hospitalize, and there's various different assumptions you have to make of what the shelter in place or the social distancing percentage rises right now, and the various different parameters that give you then a number. And so based on fairly conservative numbers, by the time we get our first case within 35 days, if we do not do something to reduce the rapidity of the expansion of this infection in the community, our system will be overrun. And we can't take care of the patient we need to take care of. And that's not just COVID-19 patients.
You can't gamble with people's lives.
No, if you come in the hospital with ruptured appendix, we're going to have difficulty taking care of you. And I can tell you by that time, if we are at the point where we can't take care of you, we'll not be able to transfer you anywhere else. Because San Antonio, Austin, all those areas.
Well, I was just going to say, if the unthinkable happens and you do get overcrowded, what's the backup plan? I mean, there's not many buildings that are clean and ready. And I mean,
we've gone to the point of even considering utilizing some of the gyms, the elementary gym in FISD.
Right.
Possibly, and then we could use some churches. I mean, all kinds
so
of
things.
There's some planning.
Let's just pray that doesn't happen. But I'm just saying but the way it's going right now, you for lack of a better term, you feel that we're skating, so to speak, right now, but that's not going to last.
No, like I said, you look at how rapidly the numbers have increased in San Antonio and Austin, and I can tell you in the counties around us, Kerr County, as of this morning, has not recorded any, but Kendall County, Burnett County, Blanco County, Ladle County, and all the counties around us have cases. And it's just going to spread to here.
Right. There's no way to avoid it, really.
We're too mobile a society.
I mean, we can flatten that curve, like you said, but yeah.
But you can't keep it from coming here. Initially, that was the game plan, to keep it from coming, but now is more mitigation because we know it's going to come. It's not now because people have traveled somewhere. It's now circulating in the communities. And so when it gets to that point, is something you can't prevent from coming in. It's just, can you lessen the speed how it rapidly is going to develop?
If the city does come to an agreement, whereas the shelter-in-place order goes into effect, what changes? Obviously, you won't be able to have 10 people or more. We know that, right. Those things like that. But what are some other changes that we should be aware of that we're going to have to?
Well, basically, it will still allow people to go to the essential areas. That includes go to your physician's office, for health care, go to the pharmacy, go to the grocery store, go to the bank. There are areas that still will remain open you can go to, but the restaurants will go to basically takeout only, which they pretty much have done.
Pretty much have done that, okay.
And the bars will close, and I don't think that has happened yet. I don't think. But those will be limiting access to areas where people will be congregating, and so we do then keep this from spreading. Also, we talked about this last evening. I would have to carry this with me all the time because I can be pulled over if I'm driving around and not abiding by this order. So I can use my hospital badge to let the police know that I'm essential personnel, so I'll be going to work.
You're already ahead of my next question. Will law enforcement, if this happens, will they have some rules other rules we got to follow that can be against the law?
I have never lived in that kind of situation, but my COO has. And yes, the law enforcement was the one to enforce that. And there were some penalties based on that.
Yeah, it's serious. I mean, it's something that definitely needs to be considered. That's for sure. What does the hospital need from us other than the social distancing and things like that? Do you need anything? What can we do for the hospital?
I think the social distancing is absolutely the most. I saw a nurse holding up a sign. It wasn't here locally, but it says, "I'm here for you. Stay home for us." Yeah. We've had so many people come and want to help, and we have people now making cloth masks for us. We have people that have donated all of their supplies that they have, their N95 masks, all their gloves that they have, and we have people bringing food for the nurses. We've had People step up to change their businesses. Garrison's distillery is now making hand sanitizer. And so
that's
that's not the only one. Several distillers in the area are now making hand sanitizer.
now we just need somebody to open up a toilet paper factory. But yeah, so no, that's great. So the community is stepping up, and there's other ways that.
Right. And I think the other thing too is the community take care of itself. I mean, there are people that are elderly that are going to need help getting food, going to need help getting supplies. And I mean, the Needs Council and the other civic organizations and churches now, they're actively formulating plans of how they can take care of the people that are going to need the help.
All right. Well, we're going to take another quick break and then come back and kind of close things out with Dr. Partin. We'll be back informing Fredericksburg. Texas Hill Country Bank understands these are challenging times, and they want to assure you that your favorite bankers are still there to help via phone or email, and their bank remains strong and focused on their customers. With mortgage rates the lowest they've ever been, now may be the perfect time for you to refinance your home, or maybe you're looking for a low-interest loan for your business. They'd love to talk to you, and if you haven't already taken advantage of their mobile and online banking options, give them a call or visit them online, TexasHillCountryBank.com, where good people make good bankers. Member FDIC.
Big Creek Communications is celebrating 20 years of connecting the Hill Country, 20 years of scaling towers, climbing roofs, installing networks, wireless broadcasting, timely responses, friendly service, technical support, expanding coverage, increasing speeds, keeping promises, providing our community with always-on high-speed internet. Big Creek Communications, celebrating 20 years of serving you.
Creek Street Dental utilizes the latest technologies in dental care. Dr. McBride has been specially trained to offer the Hill Country sedation dentistry. Anxious patients can sleep through oral surgery in a private room with family nearby. Their CBCT machine provides near-silent imaging, making possible the most painless and effective treatments. iTero technology allows virtual manipulation and modeling, so no more gagging on impression trays. Call 830-990-1178 for the best in your family's dental health today.
Vogel Tractors, specializing in low-hour, high-quality ag equipment. Area farmers and recreational landowners put their confidence in Van and Jamie, knowing their tractors, loaders, and farm implements will exceed expectations. All equipment is well-serviced and field-tested, and if new is what you need, Vogel Tractors is your Rhino Ag equipment dealer in the Hill Country. Warranties, financing, and delivery is available locally or nationwide. Vogel Tractors, located on Highway 290 between Fredericksburg and Stonewall.
All right, we're back informing Fredericksburg, and we're going to pull Caleb in. We actually had somebody that had a good question on the chat, and he's going to come share that and have you answer it. So
the question is, if there's a patient that has the virus and is not showing symptoms, can they be contagious, and how long can they be contagious for?
Well, if they had the virus, they would have had, at this point, have symptoms to get tested. So my assumption is the question is, how long could we have to wait for those symptoms to abate before you can actually be non-contagious? And so the CDC's guidelines is that you need to remain self-quarantine if you have the virus until 72 hours after the last temperature elevation and 72 hours after the last symptom. And so if you had a cough has to be gone, the temperature has to be gone for 72 hours. And also you had to have had illness for 7 days, because some patients have actually gotten better and then gotten worse. So you have to have go through at least 7 days of the illness before those 72-hour clocks start. And then after you've done that, we do think that we're safe then to get back in around people.
that was a very good question. Are there places to go to get your symptoms checked, or what do you recommend on
the CDC has a very good self-checker. So if you go to cdc.gov and in their search box in the top right corner of their homepage, if you'll type in coronavirus self-checker,
nice,
then it'll go to it'll be interactive questions that ask you various levels of your symptoms, your age, your comorbidities, what illnesses you have, and then give you then advice what to do, whether you need to actually stay at home, self-quarantine, or whether you need to contact your physician, or whether you need to even consider going to the emergency room. And I want to say at this point, it's imperative that patients do not just show up in a doctor's office or show up in the emergency room. It's imperative that the patients who feel that they may have COVID-19 call before they do. Because if it's a minor symptom, the doctor will recommend you staying at home. If it is major symptoms and it is something that should be checked out by the emergency department, then we'll come to the entrance to our ER where the ambulances back up, and there is a red box. Instead of a red box is a red phone. And that phone immediately rings a nurse inside the emergency department. Give them time to gear up and put their PPE on and come out and put a mask on the patient and escort them directly into our isolation room. If by chance you have to call EMS, definitely let the EMS know that you think you may have coronavirus, because it allows them to be careful in their PPE before they come as well. Otherwise, we're going to expose our healthcare workers, and we can't lose any of them. We need them all right now.
Well, thank you, Dr. James Partin. Again, I want to thank you for taking time out of your hectic schedule to be with us here on Informing Fredericksburg. Dr. Partin, Chief Medical Officer at Hill Country Memorial Hospital. Final thoughts. I'm going to turn it over to you. And what are some things that we need to know here in Fredericksburg and everywhere else? At
this point, I think that fear is actually the emotion. I don't think fear is actually necessary. I think actually we need to have an awareness of how we actually deal with this. My concern is some of the population is not taking this seriously, particularly the younger generation.
Yeah.
They feel like they're, and I did too when I was that age. I mean, you basically right. You're immortal, and so concern is there are people actually dying there in that age group, but also once they get it, when they go back to see grandpa, grandma, they may give it to them, and that may be something that could be lethal to them. So I think all generations need to take this very, very seriously. And I think we just need to plan on this being not a short-term thing. It's not going to be over in a week.
All right.
And we need to make sure that we are ready for dealing with this and social distancing for some time to come.
Stay calm. Stay calm, folks.
Stay calm.
Stay calm. Stay at home.
Stay calm, stay alone, and stay alert.
Right, exactly. Well, thank you so much here, little. I really appreciate you coming in, and God bless you, folks, and thank you all for viewing and listening. God bless everybody.
Segner's Jewelers supports the community during this difficult time. We will get through this. They're here to help any way they can. From their family to yours, God bless and keep the faith. From Segner's Jewelers.
Cordially Invited, a special service for special events. Anywhere in the Hill Country. Family and friends won't have to miss it after all. From the producers of Billy's.live. Cordiallyinvited.live. Find us in all the familiar places.